I like to keep the feet up anytime I'm doing supine. That just, you don't have to have the feet up for every one of them, but I just do, and that way I'm always in the same position. Come on over to the edge, please. Okay, so what I'm looking for is I want to make sure that I get Boone into full extension, and to do that I'm going to have a towel here, and I feel pretty good that I've got full extension for him. Okay, you have a very wide carrying angle. Do you remember what carrying angle was?
That's like
Yeah, look at Boone's.
Girls mainly have bigger ones.
His is like 22 degrees. Okay, all right, so what are our landmarks? So we're going to palpate for the lateral epicondyle. What is going to be our landmark down here?
Radial style.
Okay, and what is going to be our landmark up here?
Chromium, or greater typical.
Yes, chromium is going to be more in the,
Yeah.
yes, okay? All right, so we want to take, and don't get confused by this because you're going to go, oh, well, this is backwards. You can use it however you want to, okay? And even though this and this is the proximal arm, this is the moving arm, you can always do it upside down as well, okay? So don't freak out when you have to do that. So you want to make sure that you're not blocked by the mat here, because if you are, you're going to be up above your joint, okay? And you want to make sure that you find your landmarks appropriately on both of them, and that you get your beginning for him is going to be at 0, and you can see he's at 0, okay? Now I want you to actively flex your elbow. Let's reline this up. Be careful because he's going to flex that wrist. Do not follow those fingers. Make sure you stay aligned here at the radius. All right, so I have 140 degrees. So am I going to do passive? What's the norm for elbow flexion? 0 to 150. Okay, so I'm going to take him and I'm going to passively push him. Okay, boom. And I've got 150 with a soft infill. Okay, so he's got a little bit of bicep here. He's got a big bicep here. And so that is what more actively is stopping the motion, and so I can push him a little bit, about 10 degrees further with that soft infill. All right, so here I've got a hard infill in the beginning with a zeroed out, and then here I had a soft infill, which is very appropriate. He's got normal range of motion. I would even consider his active range of motion normal, just stopped by the approximation of his muscle. But that is elbow range of motion. Very simple. The only thing you got to make sure is that some people have hyperextension here, and so you want to make sure that you get it all the way as far as they go, okay? Because if you don't have the accurate range of motion. The other thing is you want to make sure you document it appropriately, so that if he started beyond 0, then we would put 10-0-150 degrees. Okay, let's say that he started here and he had a little bit of an elbow flexion contracture, then our infield is probably going to be either boggy or springy, and we're not going to get 0. We're actually starting at about 5 to 7 degrees, so we would say 5 to 150 degrees. All right,
So
so
you gotta measure that first part.
always make sure you get the beginning point. It may not be 0, okay? It may be less than 0, and then we start from the number and go up. It may be hyperextended more than 0, and we say that number to 0 to our maximum flexion. But that's all with elbow. That's our infill, that's our proper positioning, making sure we do our towel. pretty straightforward on our landmarks as well. Any questions on